Okay, so next is the popliteus muscle. So it originates on the lateral tibial condyle, lateral femoral condyle, excuse me. It goes down the medial line of the tibia back here on the posterior side. Its actions are it internally rotates the tibia and also helps and assists in flexion. The main muscle test for it is you're just going to rotate your foot inwards for me. Good job. Next muscle is the pubic symphysis. It originates, next muscle is the gracilis. Originates on the pubic symphysis and inserts here on the pes anserine, so it runs down the medial portion of the thigh. It does hip adduction, knee flexion, and also assists in tibial internal rotation. So what I'm going to have you do is just lay it back for me and lay on your stomach for me if you can. You can do this. You can do the mental muscle test by doing hip abduction, but another way to do it is just here. You're going to internally rotate. Don't let me pull down. Okay. Good job. So the next one is the semitendinosus. This one's on the originates on the ischial tuberosity and comes down to the medial tibial flare. Down here, this one helps in knee flexion and hip extension back here. So just like the last main muscle test, rotate your foot in. Don't let me pull down. Good job. The next one is semimembranosus. This one's also on the ischial tuberosity, but this one comes down on the pes anserine. That's where it inserts. Also does knee flexion and hip extension for its actions. Again, so if you internally rotate, I pull down. Okay. So the next muscle is the bicep femoris. This one's on the lateral lip of the linea, and also the ischial tuberosity. This one comes down on the lateral fibular head and on the medial tibial condyle. The actions are also knee flexion and hip extension. For this one, we're going to externally rotate that foot and pull down. Okay. Okay, so the next one is the quadratus lateralis. So tell you what I'm going to do real quick is to flip towards me and sit down for me. This one is on the greater tubercle, or the greater tuberosity, excuse me, and it inserts on the patella tendon, on the tibial tuberosity via the patella tendon. So what I'm going to have you do, have you internally rotate your foot there, and then just come out. Good job. Okay, this next muscle is the quadratus medialis. It originates on the anterochanteric line. Inserts also on the tibial tuberosity via the patella tendon, and this one also does knee extension and hip flexion. So I'm going to have you externally rotate that, okay, and then come out. Good job. Next muscle is the quadratus intermedius. This one's on the upper 2/3 of the femur here, and it comes down and inserts on the tibial tuberosity via the patella tendon also. Also does knee extension and hip flexion. So just have you put your foot straight for me. Okay, great. Good. Okay, the next muscle is the rectus femoris. It originates on the inferior iliac spine up here. Also comes down and inserts on the tibial tuberosity via the patella tendon. Also does knee extension and hip flexion, okay, and just like again, have your foot straight, come out to me. Good job. Okay, so the last muscle part of the thigh, kind of knee region, is the sartorius. It originates on the anterior superior iliac spine, and it inserts on the pes anserine down here. It does hip flexion, hip abduction, that internally rotates the thigh, and that's kind of all its actions there. Last one I have to do is just lay back for me. I'm going to do it on this leg here so you can see the test. Put it in this motion here, rotate. Okay, do not let me pull down and push in.